Good evening. I'm Nima and this is Forum Daily for Wednesday, October 5th. And tonight, Hockey Canada is dealt another blow amid its ongoing sexual assault scandal. Hockey Quebec says it has lost confidence in the organization and will not transfer funds to the national body. The provincial federation confirms to the Canadian press that its board of directors adopted a motion last night. It said that it does not believe Hockey Canada's current structure can change hockey culture. Hockey Quebec has also decided to keep a portion of registration fees, which are normally handed over to the national organization. The fees amount to about $3 per sign-up. Hockey Canada continues to defend its leadership over its handling of alleged sexual assaults and how money was paid out to victims in lawsuits. Drivers across Canada expected a larger jump in prices at the pumps, with whispers of a 10-cent hike overnight. But luckily, that wasn't the case. The jump was much smaller, with CAA's gas price tracker listing the national average cost of gas at nearly $1.64. Ontario prices averaged 2 cents more than the day before, this with Toronto seeing a change of just over a penny. When it comes to filling up, though, the highest prices still sit in British Columbia, with a provincial average of nearly $2.29 per litre. Taking a look at the country's merchandise trade surplus now, which was $1.5 billion in August, according to StatsCan. It is the smallest monthly surplus for the year so far. Compared to a revised surplus of $2.4 billion for July, the results were down from an initial reading for the month, which indicated a surplus of $4.1 billion. StatsCan says total exports fell 2.9% to $65.4 billion in August. Now, this moves it lower for a second consecutive month. Turning to Toronto, where the Regional Real Estate Board is blaming interest and mortgage rate hikes on the latest home sales data. This comes as sales were falling 44% in September compared to last year. Home sales dropped as the market saw the lowest number of new listings posted in 20 years. The fall in listings amounts to a 17% drop from a year ago and the lowest number for the month since 2002. All right, well, on the East Coast, Nova Scotia's Public Works Minister says there's no question that the province's rebuilding effort after Fiona will be an expensive one. Kim Maslin says cost estimates for repairs to roads and other infrastructure are coming in extremely high. She attributes the spike to the rising price of construction materials like steel and asphalt, as well as increased labor costs. Federal officials warn that there is currently no way to enforce building or fire codes on First Nations. They add in a briefing note that a legislative fix would require significant time and money. Blaine Wiggins is the senior director of the Indigenous Fire Marshal Service, and he said that enforcement gap has, quote, catastrophic consequences. House fires have long posed a major safety risk to those living on reserve. The families of people killed in Flight 752 say the federal government hasn't done enough to get justice for their loved ones. Hundreds of Iranian Canadians gathered on Parliament Hill yesterday to mark 1,000 days since the air tragedy. The Ukraine International Airlines flight was shot down by Iran's military. Deputy Prime Minister Chrystia Freeland said that the government will do more to punish what she calls the brutal dictatorship in Iran. The crowd called for Canada to endorse calls for prosecution at the International Criminal Court. And in the Northwest Territories, the health minister says the government is working with communities to provide supports as they grapple with an increase in suicides. A report issued by the territory's chief coroner says the number of deaths by suicide so far this year have exceeded the 10-year average. It says there have been 18 suicides in the territory as of the end of September, and the majority have been among men in their 20s. The Beaufort Delta region in the northern part of the territory has been most affected. Back in the east, Newfoundland and Labrador is extending its Come Home 2022 tourism theme to medical professionals. This in an effort to recruit more doctors. The province announced a recruitment campaign yesterday. It includes a payment of $100,000 for physicians who come home to practice. The physicians must have been born in the province or have ties to the province, and they must sign on to practice in the province for 5 years. Nurses and paramedics meeting the same criteria will get a payment of at least $50,000. All right, stay with us. We'll be right back shortly. Forum Daily's weekly medical segment with Dr. Abhishek Raut, medical director at Appletree Medical Group, is up next, so stay tuned. As the Omicron variant continues to dominate infections in Canada and around the world, experts say vaccine boosters will be put to the test this fall. Although infections are not expected to surge like they did in 2020 or 2021, officials are keeping their eyes out for a rise in cases. Scientists have yet to find out what else the virus has in store for us, so it's still not known whether COVID-19 is done with us just yet. Well, joining us now to talk more on this in our weekly medical segment is Dr. Abhishek Raut, medical director at Appletree Medical Group. Dr. Raut, welcome back.
Thanks so much.
So, where is Canada currently at in terms of infections, Dr. Raut?
All right. So we can actually talk even on a global level. If we're looking at global COVID levels, we've seen a good decline in the last few weeks, cases dropping about 11% and deaths declining about 18%. So Canada is definitely following that trend. Majority of Canadians at this point have caught COVID-19 since Omicron, and we've seen a lot of that immunity that's present as well. The estimates are suggesting that almost two-thirds of us have had COVID-19. So what we're seeing is adults, especially with about 60 to 70% of adults less than 60 have had some sort of prior infection, and 40% of adults above 60 having some sort of infection as well, which is much higher than before, which is only 15% in March. So all to say that I think that we are at a stage where there is a level of immunity, perhaps herd immunity, that is going to help us into further waves there.
Now, staying on that note of immunity, Dr. Raut, we mentioned that Omicron subvariants are able to surpass previous infections. So, considering all of that, what are scientists keeping their eyes on as we head into the fall and winter months?
I think what we need to do is keep in mind that we do have these two new variants coming in, so BA 275.2 and BQ 1.5. And what we've seen with those is that they have some level of evading. Now, how much, we're not entirely sure yet, but there are some studies from Sweden that's been found to show significant ability to evade immunity from antibodies in the population. Despite all of that, though, remember, these two subvariants are still just a very fraction of all total infections, Canada being mostly 85% BA 2.5 at now. So we're all just are concerned, but they would still need to see where those subvariants go in terms of the greater population.
And do we have any more information about the effectiveness of boosters on these particular subvariants, Dr. Raut?
Right. So what we know is Canada did approve this updated bivalent COVID-19 vaccine. It's supposed to target both the original virus and the original Omicron BA1. And the idea behind double targeting like that is it would help prevent future waves. If we look at subvariants, they seem to evolve from previous variants. So if we get protection from these previous, it can help with subvariants. As an example, at least the studies are showing that this bivalent vaccine should have high neutralizing antibodies against BA4, BA5, as well as, if we remember, the alpha, beta, delta, and gamma variants of COVID-19. So we think it should help reduce the risk, but of course, we're still seeing the data come in.
All right, Dr. Raut, I'm going to ask you a tough question here, but how likely are we to see another wave of infections this fall or winter? What are your thoughts on that?
Right. So I think what we're seeing is mandates are dropping across the country. People are making their own decisions about masking. And this combined with these new two subvariants means likely we will see more infections. In the past 2 years, the cases of mutating disease spread very quickly in the fall months, and many require treatment in the hospital. So I think we will see that jump. However, I think we're going to see that it's going to be less of a burden overall.
All right, Doctor, it looks like we've got about a minute left here, but what is still not known in this ongoing battle against COVID-19?
That's a good question. So if we're looking at even the new cases that are coming in, we do expect case counts to rise. We do expect people test positive for COVID-19. We see the evidence of that in the wastewater systems as well. But the real question is, what does that translate to? So far, we're seeing that there are fewer patients in intensive care units and fewer patients who are hospitalized. So we may reach a state where we are getting multiple infections, but minimal hospitalizations and ICU ventilators and the rest requiring. So if that's the case, we really need to flesh out that data to see where exactly the COVID-19 pandemic would go, and would it turn more into a mild influenza at that point.
All right, lots to keep our eyes on. Dr. Raut, thank you again for joining us today on Forum Daily.
Thanks so much for having me.
Stay with us. After the break, we will return to take a look at physical activity levels among kids and youth across the country. We'll unpack ParticipAction's latest report card, which gave young Canadians a failing grade when it comes to active living. We're going to be speaking with Dr. Leigh Vanderloo. Now, they are the scientific director at ParticipAction. And of course, we'll have more news from around the world after that. So stay with us. Forum Daily will be right back after a short break. The ParticipAction report card is giving Canada's kids and youth an overall grade of F for the third report in a row. The study has found physical activity dropped and screen use soared during the pandemic. However, it acknowledges that COVID-19 containment measures, such as the closing of schools, may have played a part in this. ParticipAction says only about 28% of the country's children are getting the recommended 60 minutes of moderate to vigorous physical activity per day. The report card takes physical activity, screen time, and sleep recommendations into account when deciding on the grade. Well, with us now to discuss this latest report is Dr. Leigh Vanderloo, CIHR postdoctoral research fellow at Sick Kids and scientific director at ParticipAction. Dr. Vanderloo, welcome to Forum Daily.
Thank you for having me.
Now, some of these findings weren't too surprising due to the restrictions of the COVID-19 pandemic. Now, considering that things are going back to normal, whatever that normal may be, do you expect a rise in physical activity among kids now?
Yeah, absolutely. I mean, as you mentioned, the decreases that we reported with regards to physical activity levels and the increase in screen use weren't that surprising, given the way that we were living our day-to-day lives during that time, the various public health mandates that were put into place. But given that schools have returned for the most part to in-class instruction, we've been seeing an uptick in enrollment for organized sports, and definitely the continuation of leveraging the outdoor play spaces is definitely something we've been seeing. I think one area that we're cautiously optimistic about is with regards to screen use. It was already high pre-pandemic. It got even higher during the pandemic. Again, all made sense why we saw those increased trends. But now that we're kind of starting to beginning to navigate out of the pandemic, of course, the virus is still very much an issue here in Canada, but figuring out how best to balance responsible and healthy screen use is definitely an area that we want to further focus on and ensure that families, schools, and policymakers have the necessary supports in place to do that.
Well, it's good to hear there is some progress. Now, what's really interesting in this report is that for the first time, the report card looked at wellness levels among minority communities, including Indigenous communities. So, how did the pandemic affect kids in that demographic in particular?
Yeah, well, we know in general that members from equity deserving as well as equity denied groups were further impacted and almost from an exacerbated standpoint in terms of how various aspects of the pandemic did impact those various groups. And the same was true with regards to their movement behaviors. And so some of the things that we found were that less opportunities were made available. There was issues with regards to accessibility, whether it was children who identify as LGBTQ 2S plus, women and girls, as well as newcomers, children who identify as being Indigenous, is definitely an area that we want to further identify. We did notice a lot of gaps, even in the amount of data available. So I think this represents a perfect opportunity to ensure that there's funding in place to get that data, that we're meeting the needs. But it was also really interesting to see that some of these particular groups actually were doing better than the national average. So for examples, we did see quite a higher number with regards to daily step count among children who identify as being Indigenous. So, there were some really great stories that did come through. Some were expected, and some were some additional identified trends that do seem really positive that I hope are some lessons that we continue to take forward with us.
All right, Dr. Vanderloo, about a minute and a half left here. But in terms of inequalities within disadvantaged neighborhoods, how can officials address that issue in particular?
Yeah, I think, it's one of those things is recognizing that the solution for physical inactivity and decrease or supporting healthy screen use habits is really a complex issue, and that it's going to take collective cooperation and coordination across a number of different levels of government, people in practice, the healthcare community, the education sector as well, to really band together to ensure that children and youth are being afforded environments that are conducive to physical activity, and really paying additional attention to some of those social determinants of health, making sure that there are issues such as around accessibility, inclusiveness of these environments aren't just focused on the physical environment, but the social environments as well. I think that'll definitely be one step in the right direction.
Some important points to consider. Dr. Vanderloo, thank you again for joining us today on Forum Daily.
Thank you so much for having me. Take care.
All right, stay with us. Forum Daily will be right back after the break. And when we return, we're going to be taking a look at the major headlines and news stories from around the world. OPEC Plus makes a major cut to oil production. The WTO warns of declining global trade. Famine fears continue in Somalia. And Elon Musk is once again making a bid to purchase Twitter. So stay tuned. Forum Daily will be right back after a short break. Stay with us. The OPEC Plus alliance of oil exporting countries has decided to cut production to boost oil prices. The move could hurt the already struggling global economy, potentially raising gas prices for drivers. Energy ministers were meeting at the Vienna headquarters of the OPEC oil cartel, and they cut production by 2 million barrels per day. This was at their first face-to-face meeting since the start of the pandemic. Meanwhile, the World Trade Organization is predicting global trade volumes will grow by just 1% next year. The unimpressive bump is due in part to higher energy prices and rising interest rates. The Geneva-based body says uncertainties about Chinese manufacturing output amid the pandemic will also weigh on the markets. The WTO is forecasting that the total amount of goods shipped between countries will rise 3.5% this year, which is up from its April prediction of 3%. The outlook for next year is down from the previous forecast of 3.4% growth in trade. Turning to the latest moves by European Union countries who have agreed to new sanctions against Russia. This time, they're aimed at imposing a cap on Russian oil prices. The price cap comes as punishment for President Vladimir Putin's illegal annexation of 4 regions in Ukraine amid its war. The 27-nation bloc will impose a ban on transporting Russian oil by sea to other countries above the price cap. The plan is to have the sanctions in place by December 5th. Well, finally, some hope for peace in Ethiopia's embattled Tigray region. The leader of Tigray has been invited for peace talks in South Africa this weekend. Now, this is part of a pan-African effort to end one of the world's most overlooked wars. If Tigray's leader actually attends the proposed talks between the Tigray and Ethiopian sides, it would be the highest level effort yet to end the 2-year war, which has killed thousands of people from conflict and starvation. As Sri Lanka continues to deal with a major economic crisis, Amnesty International has appealed to international creditors to provide debt relief to the country. Now, this is in hopes of alleviating suffering as its people endure hunger, worsening poverty, and shortages of basic supplies. The London-based international rights group said the country's grim situation has stripped away people's access to their rights. For months, Sri Lanka has been in the grip of a dire economic crisis, and the country has defaulted on its foreign loans. The government is in talks with creditors on restructuring the country's more than $51 billion of total foreign debt. Back in the Horn of Africa, Somalia is in the midst of the worst drought that anyone can remember. More than 1 million have fled. A rare famine declaration could be made within weeks. Climate change and fallout from the war in Ukraine are in part to blame. Thousands of people have died, many of them children. The drought has astonished herders and farmers by lasting 4 failed rainy seasons, and the 5th is underway and likely to fail as well. Best before labels are coming under scrutiny as concerns about food waste grow around the world. Best before labels are used to estimate peak freshness, and they have nothing to do with safety. Some worry they encourage consumers to throw away food that's perfectly fine to eat. Some major UK chains recently removed best before labels from pre-packaged fruit and vegetables, and the EU is expected to announce a revamp to its labeling laws by the end of the year. And the Twitter saga continues for Elon Musk, with the billionaire now saying he's ready to buy the social media platform. This comes about 6 months after he tried to back out of the $44 billion deal. His announcement also comes 2 weeks before Twitter's lawsuit against the Tesla CEO was set to go to trial. While some logistical and legal hurdles remain for Mr. Musk, he could be in charge of Twitter before the end of the week. Looks like the Nobel Prize for Chemistry has been jointly awarded to 3 scientists for, quote, snapping molecules together to create materials. Carolyn R. Bertozzi, Morton Meldal, and K. Barry Sharpless are sharing the prize. Their work is used to make cancer drugs, map DNA, and create materials that are tailored to a specific purpose. A menagerie of parrots has been rescued from a Pine Island bird sanctuary. It comes after its owners refused to evacuate without them in the aftermath of Hurricane Ian. The mission, dubbed Operation Noah's Ark, transported 2 lemurs and 275 exotic birds to West Palm Beach, Florida. They will be returned when normal life is restored to the island. All right, I'm Nima Rajan, and that'll do it for your look at national and international news for today. Remember, for more news on demand, you can always visit our website, thenewsforum.ca, or follow us on our social media handles. Take care, Canada. We'll see you next time on Forum Daily News.